Based on the recently released Uganda AIDS Commission report, Mbarara is ranked the third with a prevalence rate of 13.1% after Fort Portal and Kalangala that ranks second. Being a cosmopolitan town, Mbarara City continues to register new HIV infections mostly in teenage girls and young mothers.
If you go to High Street, for example, from 8 o'clock up to the roundabout down the road, the girls are already paraded. Those are commercial sex workers, and those are high-risk groups.
As a country, there are things we have denied for long, that young people are having sex. These young people go and have sex. So if parents or schools cannot come in, religious leaders, to demystify what sex is to them, then they go out to explore. They have also been exposed to materials that are inappropriate to their age. Pornography, internet is in the hands now.
The Uganda Population-Based HIV Impact Assessment Report indicates that HIV prevalence is nearly 3 times higher in young Ugandans aged 20 to 25 compared to those aged 15 to 19. More still, this prevalence is 3 times higher in females than males aged 15 to 24.
In most cases, the girls cannot defend themselves. They cannot negotiate for safer sex. Somebody has already given you money, he determines. So they become overpowered.
When COVID was happening, people were locked, unprotected sex was going on, girls were being raped, women could also not access some services, men could not access condoms. So the rate of HIV prevalence went very high. It was the only leisure activity that people remained with.
Mbarara City is reported to have over 6,350 commercial sex workers, majority of whom found themselves into this business due to peer pressure, parental neglect, burden of orphanage, domestic violence and poverty, among others. But in a bid to cap down new HIV infections in Mbarara and the neighboring districts, the USAID-funded project, dubbed Determine Resilience Empowered HIV-Free, mentored and self-embarked on training young and vulnerable girls who are at risk of acquiring HIV in hands-on skill to boost their financial capabilities.
But also empowering them economically will also help them in such a way that they are not easily swept away by men who have money that can convince them, buy them with little incentives so that these men can easily give them HIV.
Of course, HIV thrives on poverty. HIV thrives, especially girls. You can't afford the sanitary towel. Girls, you can't say no. But with the level of skill you have seen here, public speaking, assertiveness, these girls will be able to know if I have sex, I can contract HIV, I can get unwanted pregnancy. Number 2, they also know preventive measures, ABC, abstain, use condom use.
Since 2020, over 40,000 girls from Mbarara have been enrolled in this program. Among these include girls who are still in school and aged 10 to 15.
We take them through different HIV prevention interventions that have been approved by Ministry of Health. Okay, the first one is abstinence. If you're not sexually active, please abstain. If you are sexually active and you have a sexual partner, get to know your status. Test yourself, go for HIV testing, test your partner.
Their male counterparts are, however, yet to benefit from this program, though there are hopes that once females are empowered, their male spouses will also benefit in the long run.